Our goal here today is technology business development. Our one major goal is to make sure that we get a chance to help you get connected to some opportunities to bid on. I'm strong, but I don't strong any company or organization to get you a contract. You got to hustle that yourself. But our goal is to create the opportunity. And if you've picked up anything this morning, there's a pretty big opportunity on the horizon, just on the health IT side. And I really believe this is going to be one of the engines that gets this economy back moving, and that's mission critical for every one of us in this room. Medent has been around for a while. They're used by a lot of physicians here in Pennsylvania. We're very pleased to have them give an update on some of the great work that they do. And to do that, Edward Regis is here to give us an update with Medent. He's coming down from the balcony here, so bear with me here.
Good morning. My goal was not to trip on the way down here, so I did that. I'm going to start off with a little bit of background. I've been with the company for 25 years, actually. And what that really means is we've been around a long time, and this technology has been growing for a long time. One of the things that was mentioned is we have a lot of practices in Pennsylvania. We have approximately 500 practices in Pennsylvania. We do practice management and electronic medical records. They need to really work together as one, and we promote kind of an all-in-one process. Out of those 500 practices, we have about 185 that are electronic medical records already. That's about 40% of the practices in Pennsylvania that we have. That's a really high number. There's been a lot of early adopters. A couple will probably be talking today, but one of the things that I'm going to do, like I talk about electronic medical records. It's what I've been doing. It's what I've lived. But today I'm going to do something a little bit different so that I don't walk on the doctors that are going to talk after me. What have we done to promote HIE? That was a request for a subject here. And we've done a lot. It was interesting because at first I sat there, I was like, what have we done to promote health information exchange as a company? All our work has been at the physician level, implementing and tying from the scheduling into a seamless interface with the doctor and right on to the billing. And then more and more areas started creeping in there. And let's see, I think I'm going to just hit this button right here. But the focus has always been, increasing safety, increasing efficiency, increasing the revenue for the practices. We're a business that's their goal. They bring us in, we make them more efficient, we eliminate the cost of buying charts, pulling, filing, remote access, all those type of things are all things that will reduce practice overhead. Okay. HIE is and has been a driving factor for many, many years. And it was kind of interesting because, and I'm going to flip my notes here so I kind of stay with it a little bit. It's been around for a long time, going back to electronic claims. Again, 25 years, I can remember getting all excited about the first time a HICVA form printed. Well, we've come a long, long way, and the goals here, increase the quality and consistency of patient care. When I think of that, I think of things like drug interaction, health maintenance, which I'm going to show you some of, and these are some really exciting things. Consistency, something where it's helping to guide in the documentation from the point of like an E&M level. Promoted risk management, reduced exposure, again, back to just having charts accessible. If I'm a doctor and I'm out sitting over here, I might pull my iPhone out, and with Medent, I'll be checking my triages, looking at a document that might have been faxed in, checking my labs, instructing my staff, even though I'm here or at dinner. And when I'm on call, it's a wonderful tool. But that remote access, the reducing exposure means I have a chart. I'm not making a guess at, geez, that wasn't my patient. It's Friday night and they were seen, they're having some pain. What meds did the doctor prescribe? No, you have it right there. And that documentation, when I hit the button and e-prescribe, that's in their chart, ready for Monday when everybody walks in and they know what's going on. Well, that kind of goes along with improved lines of communication and accountability. Accountability is one of my favorite words. Again, for the first 15 years that I was with Medent, I was their manager of installation and training, and really accountability was right down to who rescheduled, who double booked, who entered this charge. Well, then it moved on to who prescribed this, who reviewed this documentation, who did this consult letter, did they receive it? Date user time stamping is an amazing tool in there. Ongoing practice overhead. I mean, everybody knows what electronic medical records is about and has been kind of about, and that is really getting rid of the paper chart. A paper chart costs a lot of money. The filing, pulling, and for any doctors in here, they all know finding sometimes. You know, sometimes they have to deal with the patient. They just don't have the chart because it's in a pile somewhere. Overhead. Many practices I walk into, one of the most wonderful and most seamless things that occurs is instead of every morning there being a pile of charts this high waiting for the labs to be dispensed to the different doctors and be assigned and then refiled and action taken. Health information exchange. The lab data flows out of all sorts of different sources. I'm going to flip on to the next screen, but from our perspective, and the reason why I'm happy to be up here, is all of this requires a good EHR, EMR in the care provider's hands so that they can get this information in real time. That's something that I think is quite important. Now, to my subject that they asked me to talk about today, really it was kind of funny because a lot of this dovetails with what the other speakers were talking about, especially in the beginning. And one of the key words was standardization. Over and over and over. That's what we've been doing for 15 years. Really, once you started getting into things like electronic claims, it used to be all proprietary. You know, Highmark had their own electronic claims and Medicare and Medicaid, their own formats. Well, with ANSI 4010, with and that X12 that we were talking about a little earlier, these are some of the standards that initially got the industry, I guess we'll say standardized here. Lab data exports, lab data imports. We're already doing this, and we have been doing this. The lab import and export, that's been around for well over 10 years. So we got a really great start on this whole process. And you know, if I take a peek here, I mean, like Holy Spirit and Pinnacle are a couple hospitals where we have a lab interface with them. For those who are trying to, you know, say, well, what does all that mean to the doctor? What it means is when they place the order, I order a CBC for a patient. Well, that order is in my electronic chart. It's not in a chart, paper chart filed up on a shelf somewhere. That's a live record sitting there, and depending on whether the hospital wants to do a bidirectional, it can be very beneficial because it just pushed the patient name, address, telephone number, their insurance information for the hospital or the lab's use. But then at the same time, for the doctors, we have these tools that say, well, what labs are left open? So maybe I'm the patient and I'm taking off from work to come in on a Friday because the doctor said, I'll see you back in 2 weeks. We'll review the labs. Well, right now, they do a chart prep. It's very time consuming. They pull the charts ahead of time. They do all this stuff. With electronic medical records, instantly I know, is that lab not here? And it's alerting the staff so that they can, you know, a couple days ahead of time, make sure that we're not wasting the doctor's time or my time coming in as a patient. So that lab import and export's been around a long time. LOINC codes, back to standardization, logical observation identifier, name, identifier names and codes. Again, I think it's kind of funny because I started kind of researching a little bit more, and I've always known a bunch of these, but there's acronyms for everything out there, and the more government that we're looking at, I'm like acronym, 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 acronym as I was listening. But